Hello, everyone, and welcome. We often talk about therapy being both an art and a science. Well, today, we're really going to dig into the science part of it, the actual architecture of a cognitive behavior therapy session. Think of it as the framework that gives all our work its purpose and its power. It's the structure that, frankly, makes the art of therapy possible in the first place.
So let's start with the big question. What really makes a therapy session work? What makes it truly effective? We all wrestle with this. But here's the thing about CBT. The answer isn't some kind of unteachable magic. It's actually something far more reliable. A clear, predictable, and most importantly, collaborative structure. This is what turns a simple conversation into a focused, powerful therapeutic intervention. And just like any good session needs an agenda, so does our time together. First, we'll look at the session's overall blueprint. Then, we'll walk through how to start the session, those crucial opening moves. After that, we'll dive into the core work, which is where the change really happens. We'll cover how to end with intention. And finally, we'll zoom out to see how each session fits into the bigger picture of therapy. All right, Section 1, this session's blueprint. Now, you might be thinking, why all this focus on structure? Isn't it a bit rigid? Well, here's why it's your greatest tool. A consistent format helps both you and your patient stay focused and build momentum. But even more than that, it creates a predictable, safe container. Your patient isn't wasting mental energy wondering what's coming next. That frees them up to do the real, deep emotional work we need them to do. So this is it. This is the standard format for pretty much every session after the initial intake. We start with a mood check, we set an agenda, we get a quick update on their week, and we review homework. From there, we dive into the agenda items, problem solving, and teaching skills along the way. Now remember, this isn't some rigid script you have to follow word for word. It's a reliable roadmap that you and your patient get to follow together every single time. Okay, so let's get into those opening moves. The first part of any session has a few really key goals. We need to reestablish that rapport, check in on the patient's mood, and then, together, collaboratively, decide on what problems we're going to try to solve today. This really sets the stage for everything that comes after.
First up, the mood check. Now, this is so much more than a simple, "So, how are you?" It's a brief but absolutely vital assessment. We use both their own words, their subjective descriptions, and objective scores to track progress over time. And here's a key tip. We always ask about their mood over the entire week, not just how they feel in that exact moment. That's how we get a much more accurate baseline.
And this is where the magic starts to happen. When a patient tells you they've had a slight improvement, asking this simple question, "Why do you think that is incredibly powerful. It gently prompts them to connect their feelings to their thoughts and their actions. You're subtly reinforcing the entire cognitive model without ever giving a lecture. It helps them start building that sense of, hey, maybe I did that. And this slide? This is a perfect example of a moment you'll see all the time in your office. A patient will often say they feel better because of something external. Their boss was away, the weather was nice. Our job is to gently probe a little deeper. I'm sure that helped, but did you also find yourself thinking any differently or doing anything differently? We're just guiding them to see their own role, their own agency in their recovery. But of course, what if you run into this? The patient who is absolutely convinced that they are powerless. They insist that nothing they do can possibly make a difference in how they feel. This is a really common and very challenging belief. When this happens, we need a concrete, collaborative tool to help them see things just a little differently. And here is that tool, the better/worse list. It's such a simple but brilliant collaborative exercise. You just sit with them and through guided questions, the patient themselves starts to identify a pattern. They see that avoidance, like staying in bed, makes things worse, while even small acts of engagement, like riding a bike, improve their mood. It makes this abstract idea of control feel really tangible and real. So, moving on to agenda setting. The framing here is absolutely crucial. We don't ask, what do you want to talk about? We ask, what problem do you want my help in solving today? See the difference? That one word establishes a problem-solving orientation right from the start. And a pro tip, gently interrupt to just get the name of the problem first so you can help prioritize before you dive too deep into any one issue. And that brings us to the middle of the session. This is the heart of it all. This is where the change happens. We've set a clear agenda, and now we get to dive into those specific problems. And it's within that context that we teach the core skills of CBT. Now, to do this work, we have to get really specific. Let's take the case of a patient, let's call her Sally, who's anxious about an exam. The key is to move from that general feeling of anxiety to the specific thoughts that are fueling it. We ask that simple question, what was going through your mind right then? And suddenly we get to the core cognitions, these catastrophic predictions that are causing all the distress. And that's what we call automatic thoughts. We explain to the patient that they're automatic just because they seem to pop into our heads, often unchallenged. It's funny, we're usually way more aware of the anxiety or the sadness they cause than the thoughts themselves. So the very first clinical skill we teach is simply how to notice them, how to catch them in the act.
Okay, so once we've caught a thought, we don't just accept it as 100% true. We teach the patient to become a bit of a detective. We guide them through this systematic evaluation. Okay, what's the evidence for this thought? Now, what's the evidence against it? And based on all of that, what's a more balanced, more realistic way to look at this?
Of course, the work we do in the session has to translate to the patient's actual life. That's where homework comes in. It's so important. If you look at Sally's plan here, you see it's a mix of behavioral stuff, like actually asking the TA for help, and cognitive skills practice, like catching her automatic thoughts. It's concrete, it's collaborative, and it's all designed to reinforce what we just learned in the session.
And just as we start the session with intention, we have to end it with intention. You can't just let the time run out. A well-managed conclusion is absolutely critical. It's our chance to consolidate all the learning from the session, make sure the patient is crystal clear on their plan for the week, and really strengthen our therapeutic alliance. It's like landing the plane after a long flight.
And that landing has 3 key components. It's a simple checklist. First, we summarize the most important points from the session. Second, we review the new homework assignments, step by step, to make sure the plan is perfectly clear. And third, and this one is so important, we ask for feedback about the session itself. Now notice the subtle shift here. In the early sessions, you, the therapist, might provide the summary. But as therapy goes on, you start to shift that responsibility. You start asking the patient, what do you think is most important for you to remember? This empowers them to synthesize their own takeaways, and it reinforces their role as an active partner in their own change process. And finally, this might be the bravest thing we do. We must always ask for feedback. And you have to be direct about it. Asking, was there anything I said today that bothered you? Gives them explicit permission to voice any concerns. That act of vulnerability on our part is one of the most powerful ways we build trust and repair any little ruptures in the alliance that we might not have even noticed. Okay, so let's zoom out for a minute. This detailed session structure we've been talking about isn't just a one-time thing. It's the repeating building block that, piece by piece, creates the entire arc of therapy over time. This timeline just illustrates that arc perfectly. You see, in the early sessions, the therapist takes the lead, really focusing on those automatic thoughts. Then, in mid-therapy, it becomes a much more shared responsibility as we start to dig into some of the underlying beliefs. And by the end, the patient is the one leading, focusing on the skills they'll need for relapse prevention long after they leave our office. It's a beautiful, gradual transfer of skills and responsibility. And what's the tool that guides this whole process? Your therapy notes. Please, don't think of them as a chore. They are not a passive record. They are an active, living guide for your case conceptualization, for tracking progress, and for planning what comes next. Diligent notes are the scaffolding that holds up the entire therapeutic enterprise. So I want to leave you with this question to think about. How does this very predictable, very reliable structure that we've outlined, how does it create the essential safety that's needed for the most profound and often the most unpredictable human change? That paradox right there is the real power of a well-structured CBT session.